Aloha! Just want to thank you for joining me today. My name is Dr. Catherine Taketa-Wong. I am a naturopathic physician and an acupuncturist. And for those of you who aren't familiar with naturopathic physicians, like medical doctors, we have to attend a 4-year medical school. We're trained as primary care physicians, and as such, I can order lab tests, write prescriptions, and do school physicals just like other doctors. One big difference is that naturopathic doctors are trained in the power of nutrition to build health from the inside. So I use personalized food recommendations, vitamins, herbs, and other types of natural medicines to address the underlying causes of disease and treat the whole person. And I also have a master's degree in Oriental medicine, which allows me to include Chinese medicine and acupuncture in my treatment protocols. So before I begin, I just wanted to let you know that if you have any health concerns you'd like to talk with me about, we offer a no-charge phone consultation called a personal health strategy session. And this is a 15-minute strategy session where we can talk about your condition and then come up with a plan to be able to help you the most. So arranging a consultation is very easy. Just call our office at 808-425-2987 and let our staff know that you're interested in a no-charge phone consultation. So let's get started, and please feel free to use the comment section to ask questions as the talk progresses. So because there was so much interest in my last Facebook Live event on autoimmune diseases, I felt that it would be good to have a follow-up session. And so today I've invited a patient to join us, and her name is Lauren. So I'll introduce you. So this is Lauren, and I really just want to thank Lauren so much for joining us today.
Thank you.
Yeah. And so Lauren has, she had a number of conditions, and so Lauren has Sjogren'S, which is an autoimmune condition that we'll talk a little bit about, and she also was suffering from Irritable Bowel Syndrome, which is also commonly called IBS, as well as PMS and some hormonal kind of issues. So just to give a basis, again, for those of you who aren't familiar with autoimmune diseases, so autoimmune diseases are conditions where basically the immune system is attacking our own body. And so it can attack certain organs or other parts of the body. And so some common autoimmune diseases include lupus, Sjogren's, rheumatoid arthritis, Hashimoto's disease, Graves' disease. There's also conditions that affect the digestive tract, so things like ulcerative colitis and Crohn's disease. And altogether, there are over 80 identified autoimmune diseases, and each one affects different parts of the body and has different symptoms. And in addition, there's really been a significant increase in the last few decades in the number of people suffering from Irritable Bowel Syndrome, or IBS. And this is a condition that can involve abdominal pain, as well as constipation or diarrhea, gas, bloating, food intolerance, basically not being able to tolerate certain kinds of foods, fatigue, and even depression. And both autoimmune conditions and irritable bowel syndrome tend to be more common in women. And we've been working with Lauren also to address PMS issues, so we have a lot to cover today. So yeah, so again, just really want to thank you, for being here, for joining me. So just to start, would just like to ask if you could kind of share with people what things were like for you in terms of the symptoms that you're dealing with before we started working together.
I was having a lot of issues with digestion, and even just eating was extremely painful. I could only eat a few bites at a time. My stomach would just be in so much pain. And I noticed it would get worse at times when I was under a lot of stress. But even at times when I felt like I was doing okay, I was eating really healthy, I was jogging, and still, it would be pretty painful just to eat. And it got to the point even where it was almost like my kids couldn't hug me because everything was just so sore all the time. So it got pretty bad.
Yeah. And then could you tell us a little bit about any other digestive symptoms that you had?
Yeah, I've been having problems on and off with both constipation and diarrhea. It wasn't anything that I could figure out what it was related to, whether it was a specific food or just a specific stressful event. It kind of seemed like everything was a problem.
Right. Yeah. And I remember it was, when we first started working together and we were talking about what you're eating, and you were eating like really healthy.
I was really trying.
Processed foods, and you weren't eating like soda and fast food.
Yeah, at that point I'd already cut out gluten and dairy, and I was still having problems.
Right.
It was a lot of trial and error with you to figure out what was going on.
Yeah. Mm-hmm. Yeah. So some of the things that we did was to look at, testing for food allergies or sensitivities, and then also looking at certain food groups, because sometimes in IBS there are certain food groups like oxalates or other kinds of foods that can cause problems. So anyway, Lauren and I were just talking about her condition with irritable bowel syndrome and, a lot of the symptoms that you're dealing with. So, and then one thing that I was starting to mention was that one thing we did find out is that you did have SIBO, or small intestinal bacterial overgrowth. So that's a condition that's pretty common actually in a lot of people with irritable bowel syndrome. And it's basically an overgrowth of your normal bacteria in the small intestine. But normally the small intestine should have some bacteria, but not very much. Most of it should really be in the large intestine. And if there's an overgrowth of the normal bacteria in the small intestine, then that can cause a lot of symptoms, including IBS. So that's one thing that we found and discovered that you had. And just talking about SIBO, or small intestinal bacterial overgrowth, is like a whole nother, we could have a whole, there's like whole conferences on SIBO. So we won't get too much into the details, but basically, there's a specific type of diet that we follow, or diet. Usually we kind of start with one type of diet and then try to customize it for what your needs are. Because you discovered along the way that there were a lot of foods that you had issues with. And then we also use sometimes antibiotics, sometimes herbs, other things to help to kill the bacteria. And there's a number of other things that you do in SIBO, so we won't get too much into a lot of the detail. But so that was something when we discovered that you had that, that added another layer. And so you also had some PMS and hormonal symptoms. So can you share a little bit?
Yeah, I mean that was something I've been dealing with. It feels like my entire life, and I mean I'd seen so many different doctors and gone through so much with them trying to figure out, how to work through this and what was going on. And I kept coming back to just being stressed, that I just need to watch my stress levels. And that was pretty much all that was done. And it made me feel, like they typically say it's all in your head. And that's kind of what I felt like I was being told over and over again. And, there's nothing we can really do about it. You just have to try to keep your stress levels low. And that was pretty much all I'd heard from so many different doctors. But it was really refreshing to come in and talk to you and actually from the first day, hear that there are things that we can do about it. There are so many options that we can try, and it's been really helpful.
Yeah, that's great. And then the last thing is Sjogren's, which probably most people wouldn't be familiar with unless they have an autoimmune disease themselves. But just to give a little background on Sjogren's, it's an autoimmune disease where the immune system, normally our immune system is supposed to attack viruses or bacteria or yeast or molds or things that could make us sick. But again, the immune system with an autoimmune disease, the immune system is actually attacking your own body. And so in Sjogren's disease, what's happening is that the immune system is actually attacking a lot of the glands in the body, and especially a lot of the glands that produce moisture. So it attacks the salivary glands that produce saliva, the glands that produce tears, and just glands that produce normal oil in the skin. And it can potentially affect other organs. And so, but some of the hallmarks with Sjogren's is that there tends to be a lot of dryness overall, like really dry eyes, dry mouth, dry skin, dry hair, fatigue, and potentially other symptoms too. So if you could share with us a little bit in terms of the portion of Sjogren's that, Sjogren's symptoms that you're dealing with.
For me, it's mostly affected my eyes, a little bit dry skin, and over the years it's begun drying out my hair a little bit too. But I don't really know how long I've had it. It just started getting really bad, I would say 2 or 3 years ago. I didn't know what was going on. I slowly started losing my vision, but it would be to the point where I would wake up one day and it would be really bad and I couldn't even see with my glasses on. And then the next day I'd wake up and everything would be okay. And it went like this off and on for about a month before my husband finally convinced me to go and see my eye doctor. I don't know why I waited so long. And she is actually the one who said, well, it sounds like it's an autoimmune condition. And she encouraged me to see my my GP and get a blood test done. So at that point we found out that my ANA was high, but they couldn't figure out exactly what was going on. So it was pretty much a diagnosis of exclusion to figure out that I had Sjogren's. And even at that point, nothing really was done, again, other than to tell me to keep my stress levels low and to add in some omega-3s, which did help, and to watch my diet. So I went along with that for about a year, and I saw a little bit of improvement. I was given some prescription eye drops, which definitely helped, but it sort of plateaued at a certain point. They weren't doing anything about any of the fatigue. They weren't doing anything about any of the muscle aches. And anytime I would get sick, it was just my immune system just went crazy. And it felt like having the worst possible flu for, weeks at a time. And it was overwhelming. So I actually found out about you at the Sjogrens Conference. And it was a breath of fresh air kind of to hear all that you had to say that I wasn't hearing from a lot of my other doctors. So it was a big difference.
And then one thing with that is that so you mentioned ANA earlier, so that's a blood test that stands for anti-nuclear antibodies, which is basically a test to see how bad it is with the immune system attacking your own body. But in that case, with ANA, your immune system is actually attacking your own DNA, like your body's own cells, which is pretty scary, And one thing we find a lot of times with a lot of autoimmune diseases is that when the immune system is so busy attacking your own body, it's almost like it kind of runs out of bullets in a way, and it's like it forgets to attack the things it's supposed to attack. So when you get sick, then a lot of times patients with autoimmune diseases, they just get really sick, and like what you were saying, it's like their symptoms, normal for most people it might last like a few days, but then it just like goes on for weeks and weeks and weeks, and they're just not getting better. And and fatigue is a really big hallmark of a lot of autoimmune diseases. So I pretty much that's one of the first things that's on my list, is that when people are dealing with chronic fatigue, I always like to screen for autoimmune diseases. And that's one thing that's really overlooked by most people. Like if people say, they go into their primary care doctor and say, oh, I'm feeling really tired all the time, then, they might screen for other things like anemia, but oftentimes autoimmune disease is really overlooked and they're not screened for that. And it typically takes people with autoimmune diseases, unfortunately, usually several years on average to get a diagnosis.
Because I remember it was probably 20 years ago that I had started telling my doctors that I'm just constantly exhausted.
Right.
And I was just told it's probably depression.
Yeah.
And it was left at that. Then nothing else was even looked into.
Right. Yeah. And so that's the unfortunate thing, is that, these, I have so many patients that come in that are told, oh, it's just all in your head. They were told by so many doctors, oh, it's just in your head, And the reality is that most times it's not, There are things that are going on, but it just really needs to be looked at, and then, have the appropriate kind of magnifying glass, so to speak, to figure out what's really going on underneath the surface. So could you talk a little bit about some of the things that, I recommended that you did, and what kind of things were maybe relatively easy and what kind of things were harder to do?
Yeah, it was a lot of, again, trial and error on the diet to finally figure out that I was talking about the lectins. And so that that was a world of difference in what I was able to eat and just getting rid of the stomach pain. That was amazing. And it I almost had this waterfall effect, I guess, on everything else. Once my stomach was doing better and I was getting the good probiotics, that also helped with my mood, and that helped with the stress levels. And then we also found some good herbs to help with the PMS and to regulate my hormones. And from there, we've also worked on, you were actually the first to prescribe me anything for the autoimmune disease other than the eye drops, which was the low-dose naltrexone. And that right there, it was so amazing. All of a sudden it was, not all of a sudden, it was this gradual getting better to the point where even if I get a cold now, I'm not laid out. I can have a little bit of a cold and I'll be okay a couple of days later. And I don't get what feels like the high fevers. I don't get the complete and total exhaustion. I can still live my daily life. And there's been a lot of additional supplements that that we've added in there. But I've found that keeping up a good daily routine, as soon as I wake up in the morning, I'll take a couple of the supplements. And then there's others that I will take with meals, just to make sure that I'm getting my timing right and that I'm not missing anything, and that it's all, we get it all in there. And I'm not missing anything.
And it is, it did end up, being a lot of supplements and everything. And as I talked about, like, as you're, once you're at the point where a lot of your digestive symptoms were a lot better, then I talked about, okay, once things are a lot better and stabilized, we're going to try to see, like, okay, what things can we slowly wean you off of, so it's not so many things. Because there's a lot of different things, homeopathic medicines that we'll use to try to help your body move towards balance on its own, to encourage your body to be able to balance the hormones better on your own. And things to support the liver, like the liver has to break down toxins as well as hormones. And most of the time in PMS, or a lot of when women have menstrual migraines or other kinds of things like that, often there tends to be too much estrogen and not enough progesterone. That's the predominant picture that we see. And the liver has to be able to break down that estrogen. And so if the liver is having difficulty breaking down really high amounts of estrogen, then those levels can hang around and then cause a lot of, like, the PMS, the mood swings, headaches, fatigue, a lot of the symptoms that we see, menstrual cramps, things like that. And, I think a big part of things is also, like, a big part that's often not addressed in conventional medicine with autoimmune diseases is the gut. And there's really interesting research finding that actually the immune system is really connected to the gut, to the digestive system. They've actually found that there are actually the good bacteria will actually, in a way, kind of like talk to our immune system cells. They'll exchange chemical messages and they'll talk to each other, and that the good bacteria are actually really important to help keep our immune system balanced. And so a lot of times when there are autoimmune diseases, very often there are imbalances in the gut, which is one contributing factor to why the immune system is, like, so out of balance. And so with almost all autoimmune diseases, we always have to really try to address the gut and see what's going on in the digestive system and try to really balance that out. And I will say I've seen that even when patients don't have any digestive symptoms at all. I have some patients that come with autoimmune disease that don't have any, like, constipation or diarrhea or gas or pain or anything like that. But then when we do testing, we do find imbalances. So So just because, so an important thing to remember is that just because you're, not having any digestive symptoms, it doesn't necessarily mean that all is well, in the gut. So, and do you have any advice to, people who are, trying to seek out like natural medicine and things for, different conditions or maybe conditions that are similar to yours?
Be open-minded and stick with it. Yeah. And it was a lot of trial and error, and I'm glad we didn't quit at any point in time. Yeah. Because I'd been through so many doctors where it was try this one thing, and then I wouldn't see them again for months. And we try something else, and it wasn't working. I wouldn't see them again for months, and then it was just kind of left at, it's probably in your head. And no one said it in those words, but that's the feeling I was always left with. But with you, at least it was, we would try something, it wouldn't work, we would try something else, and it was just a constant, we will find the answer. Yeah. It wasn't just, okay, I'm sorry. Right. So, but sticking with it, definitely sticking with it.
Yeah, and that is a really, really big key to success. And we have programs that we call Partnership for Health, and where there's like a set frequency of visits and phone consults and other kinds of things where we're following up on a regular basis, where it's not just like months and months in between visits, and where we're following up regularly to check. And then I always follow up and see, okay, I recommended X, Y, and Z, how things go, and then do we need to adjust doses or try this other thing, or okay, then we can cross off the list, okay, it's not that thing, okay, and then go on to the next thing. And that consistency is the most important thing, with autoimmune diseases. And I had a patient once with rheumatoid arthritis that came in and said, okay, I'm giving it a month, and if I don't feel better in a month, then I'm going to go on the drugs. Oh. And I said that, you could think that way, but that's not going to be enough time. Yeah. With autoimmune disease especially, people, they get a diagnosis, but the reality is that it really takes years for your body to get to that point. It's been years of imbalances in the gut or imbalances in the immune system or nutrient deficiencies. There's a lot of vitamins like vitamin D and zinc that are really important for your immune system to function normally. So if someone is deficient for many years, then that can cause these issues with the immune system to get worse and worse. And it's not something that's just gonna be corrected in a month, and it really takes that consistent follow-up, that consistent and that persistent effort is really what it takes. But in terms of the outcome, not having to depend on drugs and everything that have, I will clarify, I'm certainly not opposed to drugs, and, especially in autoimmune diseases, rheumatologists are really important especially when things get really severe, because a lot of autoimmune diseases can be life-threatening, and drugs are important a lot of times to try to keep things under control, to, save people's lives. So I'm not opposed to the drugs, but then the thing is that a lot of them do have a lot of side effects. Exactly. And there's concerns with, it harming the liver or the kidney or things like that. And so, if we can avoid the drugs, it's usually better in the long run. So if you could just kind of share now where you're at in terms of your symptoms and how you're feeling now.
I still have good days and bad days, but even my bad days now are what my really good days were before. So I'm not dealing as much with, the mood swings and the cramping from the PMS. I can eat foods that I couldn't eat before, partially thanks to the diet that you and I have figured out together, and also to some of the supplements that have sort of given me back some of those enzymes that apparently I'm just not making on my own. And yeah, it's a huge difference. Yeah.
And then how about like the abdominal pain? Are you still having abdominal pain on a regular basis?
If I stop paying attention to my diet, yes. So that's definitely going to be lifelong. Yeah. Every now and then, I'll feel like I'm doing really good for so long, and I'll think, okay, we'll try this again, and I'll find out that no, this still doesn't work for me.
Yeah.
So I think dairy is out forever, but that's okay. I think it's worth it at this point in time. But yeah, as long as I'm paying a good amount of attention to what I'm eating, the abdominal pain is gone and doing pretty good.
Yeah, that's great. Yeah. And how about that fatigue? Just feeling tired all the time and everything.
That's gotten a lot better. I mean, again, during stressful periods, it'll come back. So making sure that, I'm handling my stress as well as I possibly can, getting in some exercise. But it's not, I can wake up in the morning and I can actually get dressed and I can get my kids ready for school, and I can go about my day without feeling like I just immediately need to go right back to bed.
Right. Yeah. Yeah. So, yeah. And then any other things that you wanted to share? Or?
I just really want to stress sticking with it. The trial and error can get overwhelming, but it's worth it in the long run to figure out what's going on. All of the tests that you and I went through, all of the different supplements that we've tried. It was a long process, but it was so worth it.
Yeah. And I really want to acknowledge you for that too, because
thank you.
I mean, it's not easy, to like keep going through trial and error and different things, and and that persistent effort, like I said, that's a really big key to success. But it's not easy, So I really, really want to acknowledge you.
Thank you so much.
Yeah. So. And so again, I just really want to thank you again for being here. Lauren, we really, really appreciate it.
Yeah.
And then one thing I will mention for our audience is that there is a conference coming up, and it's the Sjogren and Lupus Foundation of Hawaii Conference, and they do excellent work in supporting people with autoimmune diseases. They're hosting a conference coming up this Saturday, May 4th. They're going to have a lot of information, not only from conventional doctors on how to take care of yourself and things to watch out for, things to be aware of, but they also talk a lot about holistic healing and holistic medicine, and so they're going to have a lot of different things in terms of like talking about deep breathing and other lifestyle kind of things that you can do to be able to manage your stress. Because that is a really, really big thing, especially with autoimmune disease, that it's really important to manage the stress, because I've definitely seen people get into like major flare-ups when they're in really stressful periods. So doing everything you can to manage, what's going on. And I have had people who've had to change jobs or other kinds of things. But if it will, keep you alive and improve your quality of life, I mean, it's worth it. So again, we put up the flyer on our Facebook page, so I just encourage you to check it out. And just again, want to thank all of you for joining us here. So want to thank Lauren again for sharing your story and the information. And our hope is that it will just help a lot of other people. And we want to thank you, our viewers, for being here. I really appreciate the opportunity to let you know more about these conditions, and just to let you know that there is hope and that natural medicine can treat it, and that drugs aren't the only answer. And so, if you would like to talk with me personally, again, we offer a no-charge phone consultation called the Personal Health Strategy Session. I would love to talk with you about your questions or any concerns, and we can be able to talk about your specific questions and then come up with a plan to be able to help you the most. So just call our office at 808-425-2987, and you'll also find the contact information here on our Facebook page. So again, mahalo, thank you again, and then we'll see you in 2 weeks. Aloha.